So what makes a good artificial eye? Let's be clear, an artificial eye is not a cosmetic device, no matter what people might think. It's a therapeutic device. It allows people to carry on with their life in as normal a fashion as possible. It enables people to sit at an interview board and get a job. It enables boy to meet girl and girl to meet boy and be happy. So it's very, very important that you do have a good artificial eye. We work with some fantastic ophthalmology surgeons who do terrific work when it comes to having to surgically remove an eye, a job that none of them really like to do because there's a sense of failure. But they're all very aware that we can only do a good job if they do a good job, and of course they do. So for ocularists and surgeons alike, we need to work together. Good surgery, good implant technique, good artificial eye work. Every artificial eye that is made should be made in a bespoke fashion. It needs to fit that individual person, and it needs to fit the conjunctiva and the perimeter of the socket and the implant perfectly. If it's hollow at the back and doesn't fit the socket, you encourage excessive socket discharge, discomfort, pain, bleeding, lid problems. So a molded prosthesis is the preferred way to go. This is a skill that takes a while to learn. However, most ocularists in the world will use this technique and use it well. So a good artificial eye would be made to measure from an impression of the socket, fitting properly, checking all the motility properly, and hand painted by the ocularist with the patient in front of them. Not a photograph, not a print, but the skill involved in the craft of hand painting the eye to get the best overall cosmetic result. I use the word cosmetic because that is the cosmetic part, is the painting. But it is a therapeutic device, and that must be remembered. That artificial eye needs to be cared for by the patient, and in so much as they need to see their ocularist 2 to 3 times a year to have it checked, reviewed, cleaned, polished, and the socket to be examined to make sure there's nothing untoward. The artificial eye ideally should be changed between 3 and 5 years, as the patient's socket will change with body weight increase, body weight loss, and general aging process. So a good artificial eye is a handmade, hand-painted, bespoke artificial eye. That's the best way.